We're going to move on from minimally invasive surgery now to laser surgery. And I want to explain that one of the reasons that we're moving on is that lasers will never ever cut bone, okay? So all the procedures that we talked about for minimally invasive surgery were bone procedures. When we talk about lasers, they are going to be soft tissue procedures, okay? So what is a laser? It is a device that generates an intense beam of light, which is man-made, not known to occur anywhere in nature. The word laser is an acronym standing for light amplification by stimulated emission of radiation. I should note, people like to worry when they see this word radiation. It is non-ionizing radiation, okay? It is not like an X-ray. You can stand next to a laser all day long and get zero ionizing radiation. A surgical laser beam can cut or vaporize tissue almost instantaneously. This word vaporize is key. The cells in the human body, especially in soft tissue, are comprised mostly of what? Water, right? So if we can instantaneously heat those cells above the boiling point of water, which is 100 degrees centigrade, we can dissolve tissue in a very accurate manner without the tissue around it being affected almost at all. Okay? And even better yet, a laser beam sterilizes and seals blood vessels as it cuts, so there's generally less bleeding, less post-op pain, and again, less chance for certain post-operative complications. So what kind of conditions can we treat with a laser? Fungal toenails. This has really changed the whole face of the treatment of what we call onychomycosis, or fungal toenails. And I will tell you that Central Florida is fungal toenail central, okay? We have heat here, we have humidity here, okay? We have feet that are inside shoes. This is absolutely, I mean, compared to what I used to see in Chicago, there is no comparison. The lasers that we use for fungal toenails are so good now that we don't even have to do any local anesthesia to use the lasers, okay? Normally, just to give you an idea, it takes 3 to 5 treatments, but the treatments are not painful and they don't stop patients from doing anything. Patients can come in for a laser treatment, go right to the health club and work out. Really come a long way. Warts. Warts are caused by viruses, okay? One of the beauties of using a laser on a wart is not only does it sterilize the virus, but warts have a really good blood supply and they love to bleed when they were removed. So the fact that the laser seals the blood, tiny capillaries, is a real benefit when removing warts. Much lower recurrence rate, less scarring when warts are removed with lasers. Ingrown toenails. So what we can do with a laser is we can actually vaporize the root of the nail that is causing the ingrown toenails, so that we can cure at least 90% of all cases of ingrown toenails with no incisions and with no stitches with the use of a laser. If we have to operate on Morton's neuromas, we can definitely use a laser to do it. I showed you the prokeratomas inside the calluses earlier. Cysts, tumors, keloids or thick scars, all great for laser treatment. Now, here is a case of traditional foot surgery, okay? You can see the long incisions, you can see the pin sticking out, etc. So now that you have seen minimally invasive procedures, would you rather have that or this? Here's the little incision after bunion surgery. Here's the bunion before, right? Great procedures.